South Korea confirmed a new daily record for COVID-19 cases Wednesday with almost 220,000 infections amid an Omicron surge. With cases soaring, schools are bracing for the start of the new semester. Kim Bo-kyoung with the latest.
South Korea has reported 219,241 new COVID-19 infections, bringing the total number of cases in the country to 3,492,686 since the pandemic began. This is also the very first time that the daily tally went over the 200,000 mark. 68 cases came from overseas, while the rest were transmitted locally. 35 more critically ill patients have been hospitalized, and there were 96 more deaths, bringing the death toll to 8,266. More than 820,000 people are getting home treatment, and more than 50% of sickbeds for critically ill patients are in use. The South Korean government said on Wednesday that although the country should not let its guard down, there is no need to worry.
We are fully prepared to overcome Omicron. We have reorganized the prevention and medical systems to minimize the number of critically ill patients and deaths. We have secured more than 2,700 beds for severely ill patients. We are maintaining the operation rate at 50%, and the fatality rate remains low thanks to the high vaccination rate.
Meanwhile, parents are expressing concerns as most of the schools begin the new semester on Wednesday. With the recent surge in mind, the ministry had previously announced a 2-week grace period from March 2nd to 11th, so schools themselves can decide whether to give lessons in person or online during the time. During the spring semester, schools will not penalize students for COVID-19 related absences and will require students to submit COVID-19 test results or confirmation documents from medical institutions if they cannot take midterm or final exams. Meanwhile, starting on the 14th, even unvaccinated students living with a person confirmed to have contracted COVID-19 will be allowed to attend in-person classes. Currently, only vaccinated students can go to school, while the unvaccinated have to stay home for 7 days in this situation. While the rule has changed, students living with someone who is infected are recommended to take a PCR test within 3 days of their cohabitant's positive result and a rapid antigen test on the 6th or 7th day. Kim Bo-kyoung, Arirang News.